Subscribe to my channel Psychology Today. Obsessive Compulsive Disorder, Obsessive Compulsive Disorder, OCD, is a mental health condition characterized by intrusive and unwanted thoughts, images or urges, obsessions that cause intense anxiety, followed by repetitive behaviors or mental acts, compulsions, aimed at neutralizing or lessening the distress caused by obsessions. OCD may affect persons of any age, gender, or background, causing severe discomfort and impairment with everyday life. Contamination, harm to oneself or others, symmetry, taboo or prohibited thinking, and dread of making errors are all common motives in obsessions. Excessive cleaning, checking, counting, arranging, or seeking reassurance are examples of compulsions that are repetitive and ritualistic. Signs and symptoms. Obsessions, compulsions, or both are signs of OCD. These symptoms can disrupt many parts of life, including job, education, and personal relationships. Obsessions are recurring ideas, desires, or mental pictures that induce uneasiness. Fear of germs or contamination. Unwanted banned or taboo ideas regarding sex, religion, or injury. Aggressive thoughts against others or self. Compulsions are recurrent activities that a person with OCD feels compelled to perform in response to an obsessive thought. Excessive cleaning or hand washing, ordering and arranging items in a certain exact manner. Checking on items repeatedly, such as continually checking to see if the door is closed or the oven is turned off. Compulsions do not apply to all rituals or habits. Everyone does it from time to time. However, an OCD sufferer will generally is unable to control his or her thoughts or behaviors, even when these thoughts or behaviors are recognized as excessive. Doesn't gain pleasure from completing the actions or rituals, but may get momentary reprieve from the distress caused by the ideas. Has major issues in their everyday life as a result of these thoughts or activities. Some people with OCD also have tic disorders. Motor tics are quick, short, repeated motions such as blinking and other eye movements, grimacing, shrugging, and jerking of the head or shoulders. Repetitive throat clearing, sniffing, or grunting noises are examples of common vocal tics. Symptoms may appear and go, improve with time, or worsen. People suffering with OCD may try to assist themselves by avoiding circumstances that trigger their obsessions, or they may use alcohol or medications to relax. Although most individuals with OCD understand that what they are doing is abnormal, some adults and children may be unaware that their conduct is abnormal. OCD symptoms in children are often recognized by parents or instructors. OCD is thought to be caused by a mix of biological, psychological, and environmental variables, with numerous genes likely interacting with environmental influences and life events to enhance a person's susceptibility. Certain brain areas' structural abnormalities and changes in activity, notably the basal ganglia and cortex, have been linked to the development and maintenance of OCD. A mental health practitioner would generally diagnose OCD based on a clinical interview and the patient's self-reported symptoms, using standardized assessment measures such as the Yale-Brown Obsessive Compulsive Scale, YBOCS, to assess the severity of symptoms. OCD is normally treated with a mix of medication and psychotherapy. Selective serotonin reuptake inhibitors, SSRIs, are a kind of drug that works by boosting the availability of the neurotransmitter serotonin in the brain, which can help alleviate OCD symptoms. Psychotherapy, particularly cognitive behavioral therapy, CBT, combined with exposure and response prevention, ERP, has been shown to be extremely effective in treating OCD by assisting patients in learning to reframe their thoughts and behaviors, as well as gradually confront and overcome their fears. Self-help measures, in addition to medication and counseling, can be beneficial in controlling OCD symptoms. Deep breathing and meditation, for example, are mindfulness and relaxation practices that can help reduce anxiety and generate a sense of calm, setting achievable objectives and creating a daily routine can also assist to structure the day and prevent intrusive thoughts and obsessive behaviors.